Testing 1 2 1 2. This is a mic check 1 2 1 2. You find that something kind of echoey? You sure? Okay.
The stars were made to worship, so alive. If the mountains, the stars were made to worship, so alive. If the oceans roaring your brightness, so alive. To worship, so alive. For if everything exists to lift you high, so alive. So alive. For if everything exists to lift you high, so alive. So alive. For if everything His promise still. You won't leave here the same way. His promise still. You won't leave here the same way. His promise still. Come on, let's go. Your promise still stands. Promise. You won't leave here the same way. His promise still. Come on, let's go.
Praise him with loud cymbals. Praise him with the clanging cymbals. Let everything that has breath praise the Lord. Praise the Lord. That is taken from Psalm 150, 1-6. Another verse is that you put off the former ways of life in the old nature, which is corrupt according to the deceitful lust, and be renewed in the spirit of your mind, and that you put on the new nature, which was created according to God in righteousness and true holiness. Ephesians 4:22. I continue. Do all things without murmuring and disputing, that you may be blameless and harmless, sons of God, without fault, in the midst of a crooked and perverse generation, in which you shine as lights in the world. Philippians 2:14-15. In the midst, finally, brothers, whatever things are true, whatever things are honest, whatever things are just, whatever things are pure, whatever things are lovely, whatever things of good report, if there's any virtue and if there's any praise, think on these things. Do those things which you have both learned and received, and heard and seen in me, and the God of peace will be with you. That was taken from Philippians 4:8-9. I continue. Do not lie one to another, since you have put off the old nature with its deeds, and have embraced the new nature. Look towards a positive attitude in anything that we endeavor to do. This afternoon, I welcome the ladies present here, and as I say, all those who are online, and we go straight into this afternoon's session, as we have a very special guest, Dr. Katrina Campbell. And she's a dentist who is going to share with us on the topic dental health and care. I think this topic concerns everyone. Everybody would like to have all their teeth in their mouth as they grow older. And sometimes we neglect to see after ourselves. So let us get some important critical information as Dr. Katrina Campbell comes to share with us. Welcome, Dr. Katrina Campbell.
Thank you, Sister Batiste, and thank you for the invitation. Thank you to everyone who is a part of this ministry, and I pray that it would continue, because we need to use or to utilize each other's strengths to help to build each other so that we can all grow in grace. I bring you greetings in the name of Jesus Christ. As she said, my name is Katrina Campbell. Self is my last name. I've been practicing dentistry for about 14 years now. And today I would like to present to you what I have learned, what I've experienced, and what God has placed on my heart to speak to you about today. So, firstly, I'd like to start with what a dentist does and what a dentist is. A dentist is basically a specialist of the mouth, a person who has been trained to treat with and specializes in the treatment of the oral cavity and the jaws. Now, dentists, some people believe that dentists just learn about teeth, but basically we are taught about everything, or almost everything, that medical doctors are taught about. Could anybody tell me why that is? Why would dentists need to be trained with the same basics of medicine that medical doctors have been trained with? Exactly, right? Unfortunately, for some, it seems that they think that the body is separate and apart from the mouth. it isn't. I mean, it sounds like common sense, but it is common sense. But sometimes it seems to me when I treat people that they don't an effect on the rest of your body, right? So that is one of the main reasons, right? And the other thing is the first point that I have here, that the mouth is a port of entry. So whatever is placed in the mouth can end up anywhere else in the body, right? The mouth also is a place that would manifest signs of any medical problems that persons may have. And at this point in time, as we're going through the pandemic, there are things that persons who have COVID-19, there are things that could present within the mouth that can help us to or identify or signify that they may have such an infection in their body, right? So the next slide. In this picture, this is an enlarged picture of what we call an ulcer. The ulcer is right here, right? Ulcers is one sign of a viral infection, not just COVID-19 infection, but other viral infections. It's something that we have known and we have seen for quite some time now. So this is one example of how what is going on with the rest of the body could manifest within the mouth. There are other problems that people may have, for example, diabetes. Persons may suffer from something called periodontal disease, which is something I will briefly discuss later on in the presentation. But that is also another thing that can present within the mouth that may indicate that somebody is suffering from some other, what we will call systemic problem. That's right. So I'll start with what is basically present within the oral cavity. There are the teeth, the lips, the buccal mucosa is that area that's inside of the cheek, the tongue, the gums, the palate, which is the roof of the mouth, and the floor of the mouth is that area that's under the tongue. So then it's not just not about teeth. It's all these things that are within that oral cavity that we have to be concerned with. So let's look at the function of the oral cavity. Number one, mastication. Mastication is just a big word for chewing, right? The other reason or the other function of the oral cavity is aesthetics, and that basically means the beauty or how you present physically. And the final thing that we need the mouth for is for speech. So we just go a little bit into what these things or how the parts of the mouth help us to perform these actions or how the mouth performs these functions. So we have teeth, of course, everybody knows, and there are different types of teeth in the mouth. The incisors or the canines are those teeth that make up mostly the front of your mouth. The purpose for them is for tearing and biting off food. The back teeth, the molars and the premolars, are the ones that we do most of the chewing on. So when we spoke about chewing or mastication, or when I mentioned mastication, we noticed that there are different shapes of teeth that's made for different functions. If we look at the animal kingdom, those animals that tend to eat a lot of meat tend to have more incisors and canines, because this is what they would use to tear that meat off. And the animals that would be herbivores, for example, cows, which will mostly eat grass, they have a lot of molars. Now, mankind has been affected with both sets, which means that we are not just necessarily meant to eat one or the other, meaning to either be a herbivore or carnivore. What we are called is omnivores. So we have been outfitted with the materials or with the equipment to eat meat and also to eat veggies. Next slide. I don't know if anyone has seen this picture before. Anybody? What do we notice about the gentleman in the middle of the picture? He's missing a tooth. Anything else? All right. He's missing an eyebrow. Did anybody notice he's missing his eyebrow? No. So we see aesthetics, how important the mouth is for aesthetics. Because we immediately notice his front tooth is missing, but his eyebrow is gone. We take some time to notice that. So that's just a brief demonstration of how important the mouth is in terms of how we perceive beauty or how we perceive a person looks. Next slide. Speech. Now this takes quite a few things, or a few parts of the mouth are involved in speech. The tongue makes contact with the teeth, both the anterior and posterior teeth, and when I say anterior and posterior, I mean the front teeth and the back teeth, as well as the palate, which is the roof of the mouth, to produce sounds. So you'll find that if some people are missing certain teeth, particularly the front teeth, they may not be able to make certain letters, sounds properly, such as S, F. Some of these letters, if we don't have our front teeth, we will not be able to articulate them clearly. And that there demonstrates why it is important for speech. Next slide. So in summary, why you take care of your mouth? Number one, what you put in your mouth will affect the rest of the body. Number two, mastication or chewing is necessary for nutrition. Number three, your self-esteem, if your aesthetics is not up there, it can affect your self-esteem. And number four, if you're unable to speak, there's a problem with communication. So this is the summary, and I wanted to go through this first because you need to understand why something is important in order to motivate you to do what you need to do to keep it functioning. I'd like you to read this aloud with me. 3-4. Most dental problems are preventable and expensive to treat. Most dental problems are preventable. One of the things, or the way that we have been trained is, I guess, long time, you just have a problem and you go to the dentist or the doctor and they just fix it. But in modern days, we seek to empower people. If you are aware of how and why, then you may be more motivated to do or to take care of yourself, basically, as Sister Baptiste mentioned earlier. People sometimes come to the office and the way they would speak, they would think as if you would think that they think that what has happened is not, is inevitable. The power basically is in your hands. This is what this statement is about. If it's preventable, I can do something about it. Now, of course, different life circumstances and conditions may have caused certain things to happen, and at this point in time in your life, what may have happened, you may not have been able to prevent it. But if you're at a stage where you can learn something, then it will be best to take that advice and to run with it. And as I use the word advice, I would now say, here in what I would say next, or most of what I would say next, is basically advice. There will be things that may not apply to you, even if I may say this age group or this group of people tend to suffer from particular things. But at the end of the day, when someone gives advice, we have choice. Just as God gave us a choice, we can choose to take the advice, or we can choose not to. What we need to understand, which direction we go in, we have to deal with the consequence. All right? So I just wanted to bear that in mind as we go along. This is a picture of Sully. It's nice to be able to go on the beach after not being able to go for quite some time, not so? All right, so as you just take a look at this picture, does anybody have any questions on what I said so far? Everybody understands? You give me a wave? All right, let's move on. So we started how we should take care of our mouth. Number one, we control our diet. Number 2, clean and inspect regularly. Number 3, avoid traumatizing your mouth. Controlling your diet, I will go into a little later. But daily cleaning and
The program? Huh? You okay with the program? No, just like that, the volume one. So you're going to volume? Yes, just like that. Because you see how she talking and I can't hear what she's saying. Is Zoom itself or what? No, I ain't hearing anything now. And these thing in my ear. I see my city
the main problem people may have had with their mouth is that they may not have the tools to keep their mouth clean. Now people are empowered and aware of what they should do to keep their mouth clean. Their diet now is a problem that's causing many people and children to have cavities today. So we look at my little funny diagram that I have here, which is just it exaggerates a bit how the teeth look. But these are the back teeth. Cavities tend to form on the top of the teeth and in between the teeth. Food tends to stick on the top of the back teeth. It tends to stick in between the teeth. So the occlusal surface and the interproximal surfaces are the areas that are mainly affected by cavities. Sometimes another thing that would cause people or predispose people to get cavities is if their teeth are not straight and you say they're malpositioned. So if you have crooked teeth, it's a little more difficult to get it clean. So this is why persons who have crooked teeth would tend to, and I say would tend to because there are a lot of people who have crooked teeth who have very nice clean teeth, would tend to have more cavities than others. This is called the Keys Triad, and it explains what is necessary for cavities to form. These three things must be there in order to form a cavity, these three factors. One, the bacteria, as I already mentioned. Two, the substrate, that's what the bacteria feed on. And as you see here, I wrote simple sugars. So basically sweet things and time. So in order to prevent decay, we have to attack the things that form this striatum here. The bacteria, it's a bit difficult to get rid of that. Everybody has bacteria in their mouth. There's bacteria in your skin, there's bacteria in your face, there's bacteria in front of your eyes. You can brush your teeth 10 times. As soon as you finish brushing, they'll be back in your mouth. So there's very little we can do about this. But we can control this, which is what we put in the mouth. And we can control this. We control the substrate by being aware of what you're eating and the time, how long you leave that in your mouth. Right? So if we go to the next slide, we will see a little more information or a little bit better explanation. I'll give you a little better explanation as to what I was trying to say there. So how my food looking? Some salad here, made by me, yes. And a nice place of food here. Anybody can see the sugar? Anybody can tell me where's the sugar in here? Right. People tend to put a little bit of sugar when they make the bake, when they make the bread, when they make the roti. Well, I didn't put any in mine, but I know that's part of the recipe when you learn it. My nice plate over here on the left with my callaloo and my rice and my stewed chicken. What's the sugar there? The stewed chicken. So imagine this. We eating what we call food here. It's not tasting sweet. But when we're done, we put our glass. Which are
I want to hear him.
No, listen to me.
Listen to him.
You have to leave your mic on mute because it's having the situation, right?
Is there one?
Sure, and I'll sugar in it. You understand where I'm going with this? We're not ready. When they tell people reduce the sugar, they tell us, I don't eat sweets. So we already put in the sugar, sometimes unnecessarily. I mean, to make the sweet chicken, well, I mean, I've learned there are other methods, but okay, we have to do that for that. But if we could avoid it, please do. Because when you think about it, it's a sort of an additive effect. You may eat one sweetie for the day, but then when you consider what you haven't eaten during the day that may not be tasting sweet to you, and the contents were that there sugar in it. If it is that there was sugar in the contents, then by the time we're done, we overload our system with sugar. Next slide, please. All right. So I already mentioned that we need to reduce the consumption of sugar. Thoroughly clean your teeth often. Why I say thoroughly? Sometimes people just brush the front and they don't brush anywhere else. Or they brush the front and the top.
Yeah,
They don't brush the inside of the teeth.
Okay.
Thoroughly clean. Every surface of your tooth needs
Just
to be
listen.
Yes, just listen.
the back teeth, or all teeth, back teeth in fact, they have what we call we have 5 surfaces. The surface by the cheek, the surface that touch the tongue, the top surface that we bite on, and then the surfaces to the front and to the back. So to thoroughly clean, we have to brush and floss. When we brush, we just clean 3 surfaces, but the toothbrush cannot get in between the teeth. And if you recall the diagram that I showed you before with the occlusal and the interproximal, food tends to stick there, and that is one of the main areas where teeth start to form decay, or where it becomes decayed. So when we don't floss, we leave in that area that is already susceptible because it's easy for things to stick there. We leave in that area out and causing cavities. And as mentioned before, it's a little difficult for persons when they don't have straight teeth. Food tends to stick in between those crooked teeth. So if you can, straightening the teeth is a good idea, meaning getting braces if necessary. Next. I just want to spend a little time on effective toothbrushing. I know most people know by now what we should do or how we should brush. We say twice a day. At least twice a day. When I ask persons sometimes how often they brush, they would tell me twice a day. But then I have to ask, when is that twice a day? When we wake up in the morning, we have a bad taste. In the morning, we have a bad taste in our mouth. So some of us tend to brush when we wake up. If it is that we brush prior to eating, then we effectively are just brushing to freshen our breath, not really to clean our mouth. So if you're a person who would brush on waking up and then brush at night, are you really brushing twice a day? Not really. You're brushing once a day. If you understand what I'm saying, because the whole purpose of the brushing is to get rid of the food that is stuck on the teeth. So when you wake up in the morning, it shouldn't really have no food stuck on the teeth because you brushed your teeth last night, right? So when we say twice a day, you need to consider that twice a day is not just 2 times for the day, but twice a day after meals. If you choose to and you wish to, you can do 3 times after every meal. And some persons who have greater risk of getting cavities will need to do it 3 times a day. But that twice, the 2 times means after you eat. Because if you think about it, we brush in the morning and we go about our day, we eat our breakfast, we eat our lunch, we snack in between, we eat our dinner. Let's say now and again, sometimes we get tired and we forget to brush your teeth in the night. Then effectively, you didn't brush your teeth at all for the day. Right? So please ensure that it's after the meals that you're counting when you're brushing. Nighttime. If you have to choose, let's say for whatever reason, I don't know, you might want to save toothpaste, I don't know. But you have to choose to brush once a day. Choose the nighttime. At night, our body is at rest. Our immune system is not functioning it's not as active as it would be in the daytime. So when we leave our mouth dirty, the bacteria really at play. It's like if our defense system sleeping, and so they get to do what they want. So one of the worst times not to brush is at night. You must brush at night. And I would add, you should floss at night as well. And when you brush and floss, do not eat anything afterward. If you do, go back and brush your teeth. If you drink something with sugar, or if it's not water, go back and brush your teeth. Because you're going to put your body at risk because as I said, you're going to be in a resting position and not able to fight off the bacteria as effectively as you would have if it was daytime and when you're active. So that's just a plug with regards to brushing your teeth. 2 minutes, it's not just done, that's the length of time. It's something that has been scientifically tested that you should brush your teeth. So it's a little more technical than just saying brush and floss your teeth. There's a time limit, there's a method, and yes, time limits and method. That's what it is. So I just would like to point out those particular things. I didn't think I need to actually come out and demonstrate how to do it. Most people know what to do, but it's just how effective is what you're doing is what I would have to, why I give these pointers here. So when people come, sometimes they ask me, well, I brushing and I'm flossing. These are the questions I ask. When, how long? That's basically it. When we go through that, then you realize, well, they're not doing it as effectively as they should. Next. All right, so I'm just going to go a little bit into, because we're talking about brushing and flossing, just to give some advice to particular age groups. Well, starting from babies, parents should introduce the idea of cleaning the mouth early on. Now, when they're born, they don't have any teeth, but get into the habit of wiping their gums. That will get the child, to understand, well, cleaning my mouth is something that I need to do. People who have comforters for their babies, some persons dip it in honey to get them to keep the comforter in their mouth. That's a bad habit. Don't do that. Bottles in the mouth. Some children and parents have their children with bottles of juice whole day or milk whole day in the mouth. And I know the reason why they continue to do this because it keeps the child quiet. But it shouldn't be introduced in the first place. It is very difficult to get little children to do dental treatment. Actually, when a child comes and their mouth, teeth in the mouth are decayed, it's probably sometimes because of these habits. Besides that, falling asleep with the bottle in the mouth. And it's not nice, I think, to put a child through that kind of thing. Cut the bottle off by a year old. Let them learn to start a drink in a cup. This will help to prevent certain habits, because what happens with children, sucking is a form of comfort for children. And this is why some children who are attached to these things would continue with it because that's their comfort. What parents can do at the time when they're weaning off the children is to find some other way to give them that kind of comfort. For example, a teddy bear. You know it's coming close to wean the child off. Every time they feed the child or give the child a bottle, they give them the teddy bear to hold. That now would help them to form a bond with that teddy bear. So by the time you're ready to pull it away, they have something else to hold on to. If they are a child who would need, because people have different needs and children, as adults are different. So if that is the case, this will help you to wean off things, right? It is not easy to just take, if a child has something, or even adults have something, and to just cut off a habit. Cool story, that doesn't take place. If you are around anyone, or you are a person who has a child that is addicted to the bottle, what we advise is that you dilute the juice. So if it is that they're drinking this juice every day, have this bottle of juice or milk in their mouth, and they have it in their mouth all day, let's say next week, you water it down by half or quarter. The following week or the next 2 weeks by half, and so on and so forth, until what is in the bottle is just water alone. That will help to wean them off over time, right? The last point I have here is do not introduce sweets to babies. I have no idea why people like to put things in babies' mouth that babies don't need. They don't need to have a sweetie in the mouth. And in fact, any unhealthy food, they won't die if they don't taste a chips or a piece of fried chicken. They won't die. There's time later for them to do. So things that are not, basically what I'm saying, I mean, I know most of you all are here, mature persons, but we have family members. And sometimes the mature family members are the ones who do the things, because I had difficulty with those things with my own family members with regards to putting things or giving the children things like this, inappropriately, meaning, the child, it wasn't necessary. So if you could avoid the child having a child forming such a habit, it would be easier later on, or they wouldn't have a habit that you have to break. We wouldn't have that difficulty. And worse yet, they wouldn't have to come to my office or any of our offices to be placed under stress, because that's what it is for a child to be by the dentist, stress. The other thing, as I already mentioned, we look at the stew chicken, etc. There's no need to put extra sugar in the milk or the Nestum or the cereal. If you look at the containers, these things already have sugar in it. So we don't need to add extra sugar when we give them. As they get a little older, they will get into the habit of brushing. As soon as they get their teeth, we probably should purchase a toothbrush with a small head and just, whether you put toothpaste or not, at least again getting into the habit. So we start with the wiping of the mouth with a little cloth, then you go with the little toothbrush. Once you start putting that toothpaste on the mouth, on the toothbrush that is, make sure the size is the size of a pea. Peas, lentil peas, that's the size, that's the amount you're supposed to use. Use children's toothpaste. Children's toothpaste has less fluoride in it than adult toothpaste. So it's not just for the bubblegum taste, but because it has less fluoride. What is the point of the fluoride? Fluoride is something that should not be ingested. It shouldn't be eaten, it shouldn't be consumed. Children tend to swallow toothpaste. So use as little bit and use children's toothpaste, just to prevent them from swallowing the toothpaste, or too much of it, I should say. And children should be supervised until they are 7 years old. They can start brushing, or most of them will get the hang of it by the time they're 4 years old, but they still need to be supervised until they're 7 years old. And going back again with a little pet peeve, I don't like when parents come with little children and tell me they don't like to brush their teeth. You have to get it done. Just like they had to get them dressed out of the bed, just like they have to go to school, it has to be done. Because at the end of the day, it will fall on the parents' hands and pockets if it isn't done. It isn't done. Next. All right. The tips for young people are simple. Brush and floss your teeth. It sounds like if it is, I shouldn't have to tell young people that, but that is another problem with young people. Some of them tend not to brush. They just don't do it. Please do it. And the other thing is the soft drinks and the energy drinks. And then again, another thing, hidden sugars again. Both these things have high sugar content. They may not taste sweet, but they have high sugar content. So they should reduce or avoid drinking these items. Next. All right, so we come to older adults. And this is more so for adults who may need help, the elderly who may need help with care. If you have an elderly person at home, you may need to encourage them and probably supervise to ensure that they brush. Because just like children, I mean, no, regular adults, most adults are afraid to come to dentists anyway. So you can imagine, I already mentioned the children already. The older adults is also difficult for them to come. Besides the fact that whether it may not just about it's not just about the fear of coming to the dentist, but the fact that they have to move around if they may not be well, to come to have to do dental treatment. Sometimes you may have to come more than once to do particular things. So if we could prevent that having to come very often, it will be good. Some older persons tend to suffer from sicknesses such as arthritis, and these things tend to affect how well or how effective simple things could be performed. So like brushing your teeth, because you're not able to hold things well or to move about as well as you could, you may not be able to brush properly. So this is why the younger person or those who are around, the caretaker needs to ensure or to assist. Some medications also can cause persons to have a dry mouth. Having a dry mouth is a problem in that saliva contains a lot of the cells or what we would need defense to help prevent or fight off the bacteria that's in our mouth. So when our mouth is dry and we're not producing enough saliva, that causes or can predispose someone to get cavities, to getting cavities. So once a person is suffering from a problem with having their mouth being dry, dry mouth, we would advise that if it is a side effect of the medication, maybe you can address or ask the doctor if there's something else they can use instead, or we can use simple things like say drinking more water, keeping ice chips in your mouth, chewing sugar-free gum that will help to stimulate saliva production. And there's something called biotin, which could be purchased in a pharmacy, which will also help with the mouth being dry. Last thing I have here is denture care. Dentures need to be cleaned the same way teeth are clean, meaning after the meals, taken out of the mouth, washed. It can be cleaned easily with a toothbrush and some dishwashing liquid. The person doesn't need to purchase the things like Polydent or those tablets. Those are not necessary. Dishwashing liquid and a toothbrush. That's all you need to clean a denture. And it should be cleaned regularly. Some persons do not take their dentures out of their mouth. When I was an intern, I was called to check out a person who was on the ward in Mount Hope. He was having a problem with his mouth. And I had to take his dentures out to examine his mouth. And as I took the dentures out, I was leaning over like this, and I had to stop. The smell, I literally had to pause. I couldn't move because of the scent that I got. So you can imagine how much bacteria is festering in there when you don't take your denture out. And I already mentioned the problem with nighttime and the immune system. So dentures should be removed at night. People can form or cause, if you don't remove the dentures, yes, you may not have teeth. Those who don't have teeth may not be able to get cavities, but it will form thrush in the mouth. And the next picture will show you what that thrush looks like. Right? It's not the white thrush that we may be accustomed with. Yes, that can form, but it usually, where the denture is, it's not very clear here, but here is very red. This is where the person wears the denture, and there's some red spots on the roof of the mouth. So that's what I usually see. Sometimes when persons come, as soon as I take the denture out the mouth, I usually ask, do you sleep with your denture? Because this is what I see. And many times they are totally unaware that their mouth is like that. Until it gets that bad, it starts to hurt, and then sometimes they're not even connecting that it's the denture. They just come and say, I can't wear my dentures, it hurt, my mouth is hurting. It's because of this. So this is the reason why we advise people, clean your dentures regularly. Do not sleep with your dentures. All right. So the first point we spoke about was with regards to dietary control that will help us prevent cavities. Regular cleaning will also help us to prevent cavities. And the other thing that will help us to prevent is periodontitis, which is called gum disease, or that's the simple name for it. And it's caused by bacteria. What happens with gum disease, that same plaque or that bacteria that is in the mouth, in persons who are susceptible, will cause damage to the gums. So initially the gums may start to bleed. And then the bone that holds the teeth in place are affected. And when the bone is affected, the teeth tend to shake. Good, nice teeth without holes just shake, and then you have to take them out. That's what periodontitis is. Usually it is formed or caused by poor oral hygiene, meaning the person basically not cleaning as they should, because as I said, it's caused by the plaque or the bacteria in the mouth. So if that is not removed, then they'll be there long enough, the bacteria that is, to cause harm to the mouth. Sometimes though, there are a minority of cases where the person who has a problem with the immune system. Again, I mentioned you need the immune system to fight off bacteria. So if there's anything wrong with your immune system, you may have periodontal disease. And these persons, we would see them with a clean mouth, but yet shaking teeth. So then what will have to happen is that you may have to investigate to see if there's any other systemic problem. For example, persons who are diabetic tend to suffer from periodontal disease. When the sugar is so high, your immune system cannot work properly. It cannot fight off the bacteria in your mouth. And so you can get periodontal disease. So that's one of the cases where I already mentioned from the beginning, where we can see things in the mouth taking place is as a result of something else happening in the body elsewhere. If a person has periodontal disease, they need to be very strict and stringent with their oral hygiene. So things that the rest of us may be able to get away a night or two without brushing and flossing, well, you have to work overtime. This is one of the cases where you should probably brush after every meal if you have periodontal disease. All right, let's go. And the final thing under how to take care of your mouth is to avoid traumatizing your mouth. There are two main things that could be traumatized, or two main presentations of trauma in the mouth. One is to the teeth, and the other is to what we call the soft tissues, which is basically everything else. Opening bottles and breaking things with your teeth is a no-no. Your teeth can be broken. I know we're in church, but people who wear tongue rings can buy the tongue rings inadvertently and cause a good teeth to break. So people shouldn't put tongue rings in. Persons who play contact sports, there are a particular group of persons who are more likely to have problems with their teeth becoming broken while they're playing sports. So the next picture will just demonstrate a little bit what I'm trying to say here. Your front teeth, top teeth, supposed to be in front of the lower bottom teeth. But in this case, the space here is a bit too wide, commonly known as buck teeth. This is class 2 malocclusion. So a child or a person who has buck teeth will be at greater risk of breaking their front teeth because they're sticking out. So to avoid these things, what you can do, if it's not possible to get the teeth fixed by braces, wear a mouth guard if you're playing sports, contact sports, football, basketball, anything that may boxing, anything that may cause you to come into contact, or predispose you to getting hit in the mouth, basically. Next picture. Again, another reason why we should, if we have a class 2 malocclusion, why we should be careful or take precaution. A child about 10 or 11 years old, she was playing in the playground, fell and hit her mouth. This is the front center tooth. This is where the other one ended up. It broke and went up. I had to pull this down, stick them together, and thankfully things worked out well for her. The teeth remained, we didn't have to take it out. So I had to pull the tooth, actually literally take the instrument and pull it out, fill it up, and then brace the teeth together until it became sturdy for itself. So that's just there to demonstrate what can happen when persons have what we call a class 2 malocclusion or buck teeth. Tooth wear, well, this tends to take place with older persons, and I will show you the pictures later on. To prevent the teeth from wearing down, that's basically losing tooth structure without being decayed, we avoid abrasive things. Abrasive things are rough things. For example, baking soda. These things are a bit too rough sometimes for your mouth or your teeth and could tend to wear away your teeth. Acidic things, citrus juices, persons who have habits where they would vomit, that's people who are maybe not anorexic. Oh, there's the other person, the other bulimic. They would tend to force vomiting. These persons would predispose themselves to having wear of the teeth. Drinking too much soft drink could cause wear of the teeth. So basically, these three things, citrus, which is orange juice, grapefruit, Portugal, any of these things consumed too much can cause you to lose tooth structure. The enamel of your tooth is eroded. And Bruxism, which is grinding your teeth when you're sleeping, is another thing that could cause you to have tooth wear. So these things that I mentioned here need to be controlled or need to be looked at to prevent tooth wear. All right, so just to go a little more to explain with the pictures, because it's difficult to explain toothway without you seeing what I'm telling you. This is where the gum is. This is the neck of the teeth. You can see the structure missing from here, right? That will usually be formed by using anything that is too rough when you're brushing. Another thing I didn't mention just now was using a hard toothbrush. Hard toothbrushes tend to damage your gums. When they damage your gums, the gums recede or they move upward. The root now, which is normally below the gum and below the bone, is exposed. It is not meant to take the pressure of the enamel, which is the part that we will chew with, or the outer surface of the teeth. So when the gum recedes, the root becomes exposed. We're using the hard toothbrush continually. This wears away. When this wears away, the nerve is easily exposed because this part of the tooth is very narrow compared to up here. So this is the reason why we tend to tell people to use a soft toothbrush to prevent tooth wear. It is sometimes very difficult to fix. We may try to fill the tooth here, but because here is the gums are a wet area, the fillings that we use now tend not to stay on teeth well if the area is too wet. So gums are wet with saliva and they bleed. We put the filling on, sometimes it may be leaking. It may not stay on very long. So if we could avoid the situation in the first place, it will be good. So this is why we should not use hard toothbrushes. This is called abrasion. That's a form of tooth wear. Next. The last thing I had written down on the slide there was Bruxism. That is people who grind their teeth when they sleep. The top surface of the tooth now is worn. So these teeth, these are front teeth, they're missing the incisal edges. The back teeth, they're missing the occlusal edges. That's the biting surface. If you notice the difference in color between here and here, this here is the second layer of the tooth, which we call dentin. So all this white area that was on top here is gone just because the person is grinding their teeth. I had on the slide before that you need to control the stress because people who tend to Brux or grind their teeth when they're sleeping is usually a response. That's because they have a lot of stress that they're not seen about. Children also could Brux as well at night. Well, the old folks would say because there's worms. But children do have stress too. Stress would not be what we would think, as adults, what our stresses would not be what a child would be experiencing. But basically, if a child has to do anything difficult or to learn anything, it's something they have to concentrate on, it's something that they have to deal with. So to them, that is stress. So what we recommend with children, if they are bruxing or grinding their teeth, is to give them an outlet in terms of either sports or playing so that they can get rid of that extra energy, that they have. Again, just like the abrasion, sometimes it's difficult to fix these things. If the person is grinding their teeth and we go and we put a filling here to fix this, it'll grind the filling off. It'll break that in a short space of time. So if you're aware that you are bruxing, then you need to figure out what is the reason. If there is no reason, in the interim, what can be done is something like a mouth guard or something to sleep with in the mouth to help you prevent from that wearing of the teeth. Because again, just like the first slide, if the tooth is worn, the nerve can also become exposed. And then we have to do a lot of treatment to fix this back. And as I already mentioned, it's a little difficult when the top part of the tooth is gone because that's where you're chewing. And fillings are never as good as your natural teeth. So once we put this here, it may not last very long because you might just grind it off eventually. We're winding down here. Damage to soft tissue. We can traumatize the mouth by putting chemicals in the mouth. Sometimes people, when they have pain, they would put the tablets next to the tooth. They might put clove, a lot of things in their mouth unnecessarily that would damage the cheeks and the gums. Crazy glue. Sometimes people denture break. They stick it back with crazy glue. They're laughing. No, this is a serious thing, They put crazy glue. That's not safe. It's not a good, it's not something. I mean, I understand, the desperation and the aesthetics and why they would do it, but it's not something that they should do. I also advise people to avoid toothpaste with whitening products. Sometimes these things like the peroxide, etc., could damage your gums, cause irritation. If it is that you using a particular toothpaste all the time and you realize you change it and things breaking out in your mouth, it may be the toothpaste, especially if they have whitening ingredients in them. And I don't really think they work anyway. That is the peroxide in the toothpaste. So I personally don't think, and many of my colleagues don't think they actually are effective anyhow. So it's up to you. Toothpicks, we tend to tell people to avoid using toothpicks because it can damage your gums. But that is particularly for people whose teeth are touching. If you have room in between your teeth, well, all fine and all well. But if your teeth are touching, this constant sticking of stuff in between your teeth could cause damage to your gums. Well, I mentioned hard toothbrushes and drinking things that are extremely hot. Well, we know the roof of your mouth could burn. I'm sure most of us have experienced that when we taste something too hot and for a good few days, your mouth on fire, that roof of the mouth. So if you could avoid damaging your soft tissues, that will be good. All right. So does anybody have any other questions or any questions at this time? Hi, Sister Baptiste. The toothpaste that include baking soda. I think you said the baking soda is unabrasive, and it was not advising. Did you advise in addition to those with peroxide that might be damaging to your gum? And I wanted to find out. I know you mentioned earlier on about a child getting a pea-sized toothpaste on the toothbrush. Is that recommended for adults too, using a pea-size? You put it along the whole length of the toothbrush. And I wanted to find out, but you spoke a little bit about what causes dry mouth, but if you find you're experiencing dry mouth mostly in the night, you could explain what causes that? Oh, the dry mouth, having experienced dry mouth in the night, you could explain what causes that? I'll go back to the pea-size just before, right? The reason why we tell parents to just use a pea-sized amount of toothpaste for children is because children tend to swallow the toothpaste. And fluoride, while it is what we use to help strengthen the teeth, it is not good to swallow. So that's the reason for the small amount of toothpaste for children. The dry mouth, that is also related to what I explained with regards to the immune system, your body being at rest. So the production of saliva at night would not be as much as if it is during the day when you're active. So that's why your mouth would tend to be drier at night. And that also ties in with the whole thing. Remember, I said don't go to sleep without brushing because all of that is taking place. The saliva is not being produced as much. The immune system is a little bit at rest. So these things will cause you to be at greater risk of forming a cavity or cavities if you miss out at nighttime brushing because your defense system is not as active as it would have been if you are awake or during the day. You had some more questions? Oh, sorry.
I've always asked myself this question when people go to do an extraction, right? And for some reason, some people pass away because they say, well, it's a saying, I don't know if it's right, they are bleeders. And that is when the pressure was very high when they did the extraction. But if I go to a dentist's office, I would not see the technicians or whoever taking the temperature of the client to know if he or she teeth could be taken out at that particular time. They will just test the teeth, test the gum, and say, okay, well, you due for extraction, and they would extract the tooth. And in that case, they would not know if that person is a bleeder. And then they could go along bleeding, and just die. So is there measures put in place for the technicians to take the pressure of the clients before they do extraction?
So just two things there that has to be addressed. People who are bleeders and who would probably bleed to death after extraction actually have a sickness that will cause that. Most of them tend to be what we call hemophiliacs. So it wouldn't just be with the teeth. They have a problem with their blood clotting. And so whether they get a simple cut, they could bleed excessively, right? So most of the times, persons who have that problem would already know prior to coming to the dentist, and they would not be able to go to a regular office. It'll have to be done in a controlled environment, maybe in a hospital, etc. The other thing, so the other part of your question is that you were asking about people with high blood pressure. I was trained to take people's pressure before I extract it. I have a pressure cut at my office. Once a person has high blood pressure, suffers from high blood pressure, and they come in for extraction, I usually take their blood pressure. So that is supposed to be done. I'll answer the question.
I'm not sure if I heard you clearly in relationship to carbon dioxide. Is it good to gargle with carbon dioxide, 3%? Yeah.
That's all right. Peroxide is okay, just follow the instructions. In that, you usually have to dilute the peroxide. It is on the bottle will tell you how much. So that is okay to, it's a mouth rinse that could be used. And I did forget to mention that when I was speaking about the elderly. Sometimes if people have difficulty keeping their mouth clean, then you may need to use mouth rinses to help. Or if you have teeth that are crooked, sometimes the toothbrush cannot get in place, to do it effectively. So yes, it's okay to use peroxide.
You said you should wash your mouth even if you drink some tea before you go to bed. However, if you're drinking herbal tea that has no sugar, do you still have to brush?
I would say, well, if it doesn't have sugar, I would still say to brush. It would not cause any harm if you do it, you understand? So it's not that you have to, because yes, at the end of the day, the reason why I was advising that you do brush after you eat or drink is because probably what you may be eating or drinking may have sugar in it, right? And just again, to just backtrack with the peroxide, when I mentioned the peroxide, it was with regards to toothpaste that have peroxide added to it, not the liquid that you would use to rinse out with.
You're talking about removing dentures. If a patient has permanent dentures, what happens with that?
Okay, so that's just a little bit of misunderstanding in terms of the terms. Dentures are removable. There are other forms of replacement of teeth, but those are not dentures. There's one called a bridge. With the bridge, they will sort of stick the bridge onto, like you're missing one tooth, so the bridge will be stuck onto the teeth that are next door. So those are not dentures. However, there is specific type of floss that's available to clean underneath those. So yes, once whatever you put in your mouth can be removed, you should remove it. Do not keep it there. But if it is cemented down, as in the case of the bridge, well then those you will have to clean in and around it, because what can happen is the teeth that are holding up that bridge, they can be susceptible to decay if things are sticking underneath there. So flossing, there's a different special type of floss. There's something called super floss, and if you're using regular floss, there's something called a floss shredder that they should show you or recommend when you have a bridge so that you can clean underneath it.
Last question. How do you because I don't think I got enough information from you, or I didn't understand. A child that grinds their teeth, you were saying is stress. Some people say maybe they have worms. I was not clear as to what was your recommendation for that.
Right. Well, I was saying, with regards to the worms, that is something that I learned after leaving school, right? Oops. So if it is that you do suspect the child has worms, or you notice the child is grinding their teeth, well, you get some worm medicine. That's the recommendation there. If it is that that has been eliminated, then you may need to consider maybe the child in their young mind probably stressing over something. And the recommendation is that they get into, well, now, if the child is in an environment where there's things going on in the home, well, that will have to be dealt with. That's the only way that they would get rid of that stress. If there is nothing that is causing the stress in terms of the family or the home, then they need to get active, playing sports, going out there, physical activity. So that's what the recommendation for that is. All right, but with regards to the worms, I wasn't taught that. I just learned that as I said, old people or old wives. I'm not sure if it's true or not, but that's what people see. So, sorry, let me just give.
Sorry. I wanted to know if periodontitis and the word pyro, which is it the same disease? So pyro is just is that a medical term too? What they used to call it, but it's periodontitis. Okay, just want to clear that.
That was the old name for it, but yeah.
I just want to find out if the dry mouth, if it's associated with diabetics, or can it happen to anybody? The dry mouth, having the dry mouth.
Yes, there are different scenarios or different conditions that could cause dry mouth. So it's not just persons with diabetes. Different, as I said, sometimes some medication, it's a side effect of some medication that people may be taking. So yes, it's not only diabetics who would suffer from dry mouth.
As periodontitis or periodontal gum was discussed, it's a disease of the gum, right? But I was once told by a dentist that to combat that, you have to do regular cleaning of the teeth. And the more you clean, the more you will get rid of the plaque under the gum that's by the teeth. And like, how often do you think you should do a cleaning? Could it be after 3 months, after 6 months? What do you think?
All right, so usually the treatment for persons who have periodontitis is that we would do what we call a deep cleaning. A deep cleaning is that what it entails is that we would numb the mouth up and go below the gum line to clean out anything that is stuck underneath there. Right? When persons have periodontitis and they lose bone, there tends to be what we call a pocket or a space between the gum and the teeth. So bacteria could go inside of there. But it's impossible for a person to take a toothbrush or any kind of cleaning tool to clean underneath the gum. So that's what we do. When we have to treat the persons who have periodontitis, there are different types of examination that we have to undergo. So we would try to measure or determine how much bone loss the person has. It is something that, so when we determine that, we do the deep cleaning, the person comes back for a review. At the review, if it is that the situation has been improved, then we would recommend the person. That's what we would use to decide whether we recommend the person comes every 3 months, every 6 months, or how often he should return. So what I'm getting at is it depends on the condition of the mouth at the time when the person comes back in. And there's also a specialist for that field. So let's say the regular dentist does the deep cleaning, they bring the person back, they check it in 6 to 8 weeks. There is no improvement. We may have to refer to the specialist. Once things are what we would say stable, then the recommendation is every 3 months. But as I said, if the person comes every 3 months for a while, a year or two, and you realize, well, things are going good, well, then we would say come every 6 months. You understand? So it depends on the thing. And even persons who don't suffer from periodontal disease, normally in the media, you would see visit your dentist every 6 months for a cleaning. Cleanings are dependent on the condition of the person's mouth. So even a person who doesn't suffer from periodontitis may have to come every 3 months because they demonstrated that they may not be able to keep their own mouth clean. So we recommend that. Just as well, some persons will come, you didn't see them in 2 years, and they don't have anything to clean. So I personally find it's unfair if I look at a person's mouth and I don't really see any plaque to clean their teeth. They have nothing to clean. I will tell you, well, your mouth is clean. You can come back in 6 months and I will review. I will check to see when you come if you need to clean your teeth. That answers the question.
Regarding the jaw, right? Is there a reason why you will get like a locked jaw at times that the mouth can't open? I know your forefingers, this is how wide your mouth's supposed to be able to open. But at times, 2 or 3, is there a reason why your jaw will lock?
Yes, your jaw joint is a joint just like anywhere else in your body. And with time, sometimes it can wear away. The cartilage, etc., that is there. So, sometimes people have problems with the knees, they can't bend. The same is a similar problem that can be taking place. It could be arthritis, or there are many other reasons. If a person had traumatized their mouth when they were younger, they got a lash, etc. So the joint now sort of moves out of place, and then the person can't get it back in place. So that's the reason for the locking up the jaw. What we will tell persons who are aware that their jaw may be locking, what we advise you do is avoid opening your mouth too wide. If you have to yawn, laugh, be conscious of it, because sometimes some persons jaw lock and they can't close it back themselves, and they have to end up by the hospital or by dentist to get it replaced. So I hope that answers it there. It could just be natural wear and tear that could cause it, or trauma that may have happened at some point in your life when you're younger.
I just want clarity on what you just said. Persons, sometimes when they open their jaws too widely, they may not be able to close it back themselves, and they have to come to the dentist to and what's the process like?
What's the process? We have to try to reposition it. Yes, and then when you reposition it, sometimes you have to band it up to keep it in place. But it's not everybody. Some persons, not everybody will have arthritis, so or any shoulder pain, or so it's a similar situation with regards with respect to things that I just mentioned, your shoulder, your knee, etc. These are joints. Your jaw is a joint just like everywhere else. So some persons would have a problem with their joint. So if they already, most of them already know, they will come and say, my jaw lock one at a time. Oh, and it's also important to tell the dentist, because if the dentist have your mouth open too long, that could also cause the jaw to lock. So if it is that we know that that's the case with the person, we would try to do shorten the time period for the treatment. But yes, it's not everybody. But what I said to her is, if it is that you're aware that your jaw is locking, then avoid opening your mouth too wide when you're yawning or laughing, etc., so that it don't lock open and you can't close it back. That's it? All right, so I hope I tend to speak very quickly. So I hope it wasn't too confusing, and I hope it was clear and understandable. And I just want to give you a bit of what I would say, a blessing. Beloved, I wish above all things that thou mayest prosper and be in health as thy soul prospereth. Thank you very much again, and may God bless everyone.
Thank you very much, Sister Katrina. Indeed, this session was quite informative. I learned a lot. I learned a few medical terms for well, tooth decays, caries, and the bruxism. I mightn't pronounce the word properly with the grinding of the teeth. So I took note of a few things, and it was quite informative. It's always good to know that, you know, we take things for granted, but it's important really to take good care of our health, of our teeth. Thank you so much for this evening, your time and your commitment and everything. At this time, well, we don't have many, we don't have many people online, but I would like to, 14, I checked my phone. We have 14. Okay. Well, are there any questions from the persons who have viewed? Oh, we don't have any questions viewed online. Okay. So I want to thank those who have joined us online. I wasn't picking it up on my phone. Thank you for joining us. And at this point, I would ask Sister Thomas Phillips to present Sister Katrina with a small token of appreciation. Please let me go and get it.
Sister Katrina, Dr. Campbell, we thank you for your time. We enjoyed your explanation. It was quite informative. All God's blessings on you and your family. And we want to give you this token of appreciation. We hope that there's not too much sugar in this, but you will know what to do. You know, natural sugars. So thank you very, very, very much. God's blessings.
Thank you once again, and God bless. At this time, we will close off our session, but we'll continue because I want to meet with the ladies present here to have a short discussion. Thank you, ladies and gentlemen, for joining us online. I think the men may have been present too. Thanks again, and have a pleasant evening.